Patient 40-year-old presents with pain in the bilateral lumbar area and radiating to flank. Now we scan the right kidney. The cortex of right kidney is smooth and shows hypoechoic texture. No mass or lesion seen in the cortex or no cysts seen. The texture of cortex is coarse as compared to the liver. Now if we see the pelvis, we see the dilatation of minor calyces and major calyces. Also we see the dilatation of the proximal part of the ureter. No debris or mass seen in the pelvis and no stone seen. The fluid is anoequic in the pelvis. The walls of calyces are echogenic and shows thin line which are normal and not inflamed. The pelvis is mildly dilated. Here we see an echogenic spot in the lower pole. It is mimicking as a stone, but this is thickening of wall and no shadows present. Now we scan the left kidney. The left kidney is normal in size and the texture of cortex is normal and smooth outline. No mass lesion seen in the cortex, but the pelvis is moderately dilated. The pelvis containing fluid contain no debris. The proximal part of the ureter also dilated and contain a calculus. The shadow of this calculus also seen. This stone causing acute obstruction in the proximal ureter. Now we measuring the size of calculus in the proximal ureter. The size of stone is 18 millimeter and oval shaped. Here we see another calculus in the lower pole of the kidney, and there is also a shadow of this kidney. Now we also measure the size of this stone. The size of this stone is 8 mm. Now we also scan the urinary bladder, which is partially filled and containing anaerobic fluids. The walls of urinary bladder are appears to be normal. No debris seen, no calculus seen. Now how we will write report. The right kidney is normal in size and texture. The cortex of right kidney is normal. No mass lesion seen. The major calces and proximal part of the ureter are also dilated, containing an aqueous fluid. No calculus seen. The left kidney is also normal in size and shows normal texture. The cortex of left kidney shows normal texture, no mass lesion seen. The pelvis is moderately dilated. A calculus size 8 mm present in the lower pole. There is also an oval-shaped calculus measuring size 28 mm present in the proximal part of the ureter, causing acute obstruction. The urinary bladder is normal. The ultrasound diagnosis is bilateral hydronephrosis with hydroureter and a calculus in the lower pole of kidney and proximal part of the ureter. The patient is referred to the urologist for treatment.